Fennel is a vegetable with a licorice-like flavor. It contains potassium, magnesium, and other nutrients with an antioxidant effect. It may have various health benefits, such as supporting digestion and preventing skin damage. Feniculum vulgare, or fennel, has a pale bulb and long green stalks. It can grow almost anywhere. All parts of the fennel plant, including the bulb, stalk, leaves, and seeds, are edible. In this article, we detail the health benefits and nutritional content of fennel. Benefits: fennel is low in calories but rich in nutrients linked to many health benefits. The main fennel bulb is a plant-based trusted source of potassium, sodium, phosphorus, and calcium. It is also high in essential fatty acids and magnesium. People can also use fennel seeds, leaves, and flowers in different ways. Research shows trusted source that fennel seeds may have antioxidant, anti-inflammatory, antifungal, and antiviral effects. A 2020 systematic review found that digesting these seeds may also stimulate prolactin to help mothers naturally produce breast milk. A person can ingest fennel seeds in dishes or as an extract. People can also steep fennel seeds, leaves, and flowers to make tea. Fennel tea may aid digestion and other gastrointestinal issues such as heartburn, bloating, loss of appetite, and colic in infants. Bone health: the vitamin and mineral content in fennel contributes to building and maintaining bone structure and strength in the following ways: phosphate and calcium. Both of these compounds are important in developing and maintaining strong bones. Iron and zinc. These are crucial for the production and maturation of collagen. Manganese. This mineral is necessary for bone matrix formation. Vitamin K. Studies associate low intakes of vitamin K with a higher risk of bone fracture. Blood pressure: insufficient potassium intake can increase trusted source a person's risk of developing high blood pressure. In addition, there is evidence that potassium, calcium, and magnesium decrease blood pressure naturally. All of these are present in fennel. Dietary nitrates in fennel and other foods have vasodilatory and vasoprotective properties. Because of this, they can help lower blood pressure and protect the heart. A 2018 study found that blood pressure levels were lower after taking nitrate supplements. Heart health: fennel contains significant amounts of fiber. Fiber decreases trusted source the risk of heart disease as it helps reduce both the total serum cholesterol and low-density lipoprotein, LDL, cholesterol in the blood. Learn more about vitamin B6 and folate. Prevent the buildup of a compound called homocysteine by converting it into a different compound, methionine. When excessive amounts of homocysteine build up, it can damage blood vessels, trusted source, and lead to heart problems. Cancer: selenium is a mineral found in fennel, absent in many other fruits and vegetables. It contributes to liver enzyme function and helps detoxify some cancer-causing compounds in the body. Selenium can also prevent inflammation, trusted source, and decrease tumor growth rates. Fiber intake from fruits and vegetables like fennel is associated with a lower risk, trusted source of colorectal cancer. Vitamin C, vitamin A, and beta-carotene are potent antioxidants that can help protect cells against damage from free radicals. Immunity: the selenium found in fennel appears to stimulate the production of killer T cells and modulates the immune system in other ways. Studies have shown dietary intake of selenium can improve immune response, especially to viral agents. Metabolism: fennel is a source of vitamin B6, which plays a vital role in energy metabolism by breaking down carbohydrates and proteins into glucose and amino acids. The body can easily use these smaller compounds for energy. Digestion and regularity. The fiber content in fennel helps to prevent constipation and promotes regularity for a healthy digestive tract. Weight management and satiety. Dietary fiber is an important factor in weight management and works as a bulking agent in the digestive system. These compounds increase satiety and reduce appetite, making an individual feel fuller for longer and lowering overall calorie intake.